Hello, my name is Sandra Edmonds. I am a fourth semester nursing student at Meridian Community College. I'm here today to present my student teaching project, and it is on STIs. I have an audience here today to include Mr. Grant and Ms. Terry. They will be helping me today with this project. STIs. They were previously known as STDs. I'm going to start this presentation with a few questions. Can anyone tell me what STI stands for? Does anyone know?
Sexually transmitted insects?
No, you're close. And after this presentation, we will go over these again. Can anyone tell me what STDs are?
Sexually transmitted diseases.
Correct. Sexually transmitted diseases. That's what they used to call them. Some people still refer to them as sexually transmitted diseases. Okay. Does anyone know what ways are there to contract sexually transmitted infections? That is correct. That is absolutely correct. Okay. And does anyone know any ways to prevent them? Don't do it. That is correct. Okay. So I'm going to start to talk. There are many STIs. These are just to name a few. Some seem to be more popular than others. And popular is not a good word, but they tend to have those more than others. Gonorrhea. Gonorrhea is transmitted through sexual contact, of course. It is more prominent in young people between the ages of 15 to 24. It is spread from vaginal, anal, or oral sex. Then we have syphilis. Syphilis is also a STI, and a lot of these printouts tell you that they're STIs because it is still called STIs, although we say STIs. It is a very serious complication when left untreated. And then we have HIV, which that seems to be a very scary STD. The name of it is HIV. It is a human immunodeficient virus. It is not curable. And then we have trichomonas. Trichomonas is also transmitted sexually, and there is a cure for it. Genital herpes. Genital herpes, there is no cure for it. It is an infection, and there is medication to help with it, and I will tell you all about that a little later. I want to just talk to you a little bit about different things about how to spread, how sexually transmitted diseases are spread. They are spread through body fluids such as semen, vaginal secretions, fluids, blood. They can also be transmitted through use of IV drugs. People tend to be on IV drugs and they tend to share their needles, and that way they become infected. There are common symptoms of STDs. People tend to have on their vaginal and their groin area. They tend to have sores, burning, especially when urinating. They tend to have discharge, which tends to be white, possibly green. They have lumps. Bumps are types of different skin texture on their genital area, itching, and they have lower abdominal pain as well sometimes. If you suspect that you have a STI, you need to consult your healthcare provider as soon as possible. As I said, there are some STIs that can be treated. There are some that can be cured. Some are also reportable. There are some STIs that are curable, such as syphilis, gonorrhea, chlamydia, and trichomonas. HIVs and herpes, they are not curable, but they are treatable. when a person is diagnosed with an STI that is treatable, they need to make sure that they complete their course of antibiotic treatment. They need to not have sexual relations with anyone. They need to let their partners know, partner or partners, because sometimes they tend to have multiple partners, so that they can be treated. They also need to use condoms or consider abstinence. As you can see, I have these little areas here. They're just different types of condoms. And I put them there because this is a preventative measure for STDs. The little eyes here, these are here to let people know that they need to watch. Be careful. You know, you need to make sure that if you're having sex with someone, you need to look. You need to look at them and make sure. You can't look at a person's face, but if you're going to have sex with someone, you need to at least look. And you have to look at them and check them out to make sure there's nothing wrong that you can visibly see at least, but you still need to use a condom. This is very important. The best way not to get an STD is abstinence. That is very important. But if you don't, you need to use condoms. You need to make sure that you know the correct way to put a condom on. You need to keep them out of heat. Make sure they're not dry. The expiration date on them is a good date on them. They don't need to be expired. I think it is good for the male and the female to know how to put condoms on. They can only be used once. Don't reuse them, and discard them in a respectable way. That's very important. We need to, especially as healthcare providers, we need to talk to the younger generation. You know, they need to know that sex is a choice. No one should force you to have sex. You know, if someone is forcing you to have sex, you need to talk to someone about it. That is very, very important. Let me see. What else I got? And if a person is sexually active, they need to have a screening done yearly to be tested or to make sure that they don't have any kind of STDs. As healthcare providers, we need to assess our patients. We need to talk to them about their sexual activities. We need to not be judgmental. We need to talk to them and see what type of sex they're having. If they're having anal sex, we need to talk to them about that. We need to tell them that they need to use condoms. You know, any kind of risky behaviors, you know, just don't be judgmental about it, because, you know, no one is without any faults or any wrongdoing, so we need to teach them the correct way to do it if it's going to be done, and that is with the condom. Make sure if you're using condoms that you use lubricated condoms as well as lubrication, and to prevent them from rupturing. Because if there's any tearing, it's as if you don't have it on. I also have for you all some pamphlets on STDs. I want to make sure that I leave these with you. As well as things you need to know about condoms and proper use, the types of condoms that you need to get. It says on this one about the condoms that you need to make sure that it is put on correctly and it is taken off correctly. If the condom is not put on correctly, it will not work. If it's not taken off correctly, it is just as if you have not used it. So those are very important things. And when opening it, be very careful not to tear it. Let me see. So I'm going to go back and I'm going to go back over my course and see what we learned. So, what does STD?
Sexually Sexually transmitted disease.
Disease. What does STI stand for?
Sexually transmitted infection.
Infections. Yes. And what are ways to prevent sexually transmitted infections?
Abstinence.
Abstinence is the best way to prevent it, but there is another way.
Condoms.
Condoms, and condoms that are properly placed and taken off. That is correct. What are some signs and symptoms of sexually transmitted diseases?
Discharge.
Yes, and this discharge can be vaginal or it can be penile discharge. You can also have abdominal pain. You can also have lesions, sores, and with herpes, you could have pustules that are intact and they can drain as well.
Odor.
Odor, yes. You can have odor, and the discharge can be of various colors. Clear, it can be white, it can be green, and it as well has an odor. Yes. Okay. Let's look in this packet that I've given you all. There are many more sexually transmitted diseases or infections than we have here. This pamphlet tells you about various sexually transmitted diseases and infections, as well as, on the back here, it says you have more to consider on the very back. And here are some treatments and preventions, as well as CDC information. The CDC is the Center for Disease Control. This is a number to get in touch with them, as well as their website. And this is also a American Sexual Health Association on the back. It's their phone numbers on the back of there, as well as their website. Are there any more questions or comments? Okay. Thank you all very much, and I really appreciate you taking this time to listen to me and allowing me to present this information to you all. Thank you.